Okay, welcome everybody to our first Heilbrunn Department of Population and Family Health weekly seminar. In the in-person world, these are usually an hour and a half, and you usually get lunch and dessert, but no such luck. But we have, the good news is we have shaved off a half an hour. And we basically try to address really relevant topics to what's going on in the world in these seminars. So we have a super relevant topic today, which is, of course, research in a virtual world and innovative approaches. I'm very excited for this myself, because I'm going to hear from people that I've heard great things about, some of whom I know, but some of whom I don't. So let me just introduce our moderator, who is the director of our program on forced migration, who will take it away after me. Monette Zard is an expert on forced migration and human rights. Her career has spanned the fields of policy, advocacy, and philanthropy. She served as the Global Human Rights Program Officer at the Ford Foundation in New York and as Research Director at the International Council on Human Rights Policy in Geneva, Switzerland. She has worked on issues of political violence and human rights obligations of armed groups, economic and social rights, and human smuggling. From 2000 to 2003, she was a policy analyst at the Migration Policy Institute in Washington, D.C., and held a visiting research in law at the Refugee Studies Center, Oxford University. There's many, many other things I can say, but I will stop there. Of course, we all are very lucky to know and work with Monette. So Monette, take it away.
Thank you so much, Terry, for that kind introduction, and welcome everyone. Welcome to this, our first Monday seminar for the semester. So as Terry indicated, Professor McGovern, the COVID-19 pandemic has raised a profound set of challenges for us all as public health professionals, as researchers, educators, and scholars and students, and of course as individuals. And as an institution that is dedicated to research and public health, I think it is particularly fitting that the first of our seminars this semester is dedicated to the topic of how our research approaches need to adapt to take into account the constraints of working in a pandemic. For those of us that had developed research projects prior to the pandemic, we're grappling with the question of how to adapt our research tools, perhaps transitioning them online, and what the implications might be for the quality of the data that we might gather in doing so. For those who want to continue doing fieldwork but can't travel, we're exploring how to work more effectively with local research partners and to do so in a way that is both supportive and ethical under these circumstances. And of course, as we strive to generate real-time information to understand the impact of the pandemic on vulnerable and marginalized communities, such as children or women experiencing IPV, we're confronted with the challenge of how to reach them under the lockdown in a way that is both ethical and safe for all concerned. So to tease out all of these questions and to discuss some of the challenges and opportunities of this new landscape, I'm delighted to welcome three wonderful speakers today, each of whom will tell us about a piece of research that they have either adapted or developed explicitly for the current pandemic context. So our first speaker will be Mark Canavera. Mark is the co-director of the Care and Protection of Children, the CPC Learning Network, which is a research practice collaborative housed in the program on forced migration and health here in PopFam. The CPC Learning Network nurtures global leadership from the Global South while sparking critical, overlooked conversations about the future of international child welfare. And among many other leadership roles in child protection, Mark serves also as the co-chair with the World Health Organization of the INSPIRE working group, which exists to promote evidence-based strategies to prevent and reduce violence against children. Our second speaker is Dr. Neetu John, who is an assistant professor of population and family health. She specializes in population and reproductive health and has worked for over a decade in Africa and Asia, exploring issues such as women's empowerment, gender-based violence, household dynamics, spousal relationship quality, child marriage, amongst many other things, and really focuses her work on low and middle income countries, and primarily in sub-Saharan Africa. So she's worked in places as diverse as Nigeria, Rwanda, Ethiopia, South Africa, Uganda, and so on. And our final speaker is Dr. Abigail or Abba Greenleaf, who is a public health demographer whose research focuses on collecting data in low and middle income countries. She is particularly interested in survey research methods across a variety of public health topics. And I think of interest for us is that her dissertation research assessed sources of error in cell phone-based estimates of modern contraceptive use among women in Burkina Faso. And I think really very instructive potentially for what we're contemplating now. Abba currently works for ICAP's population-based HIV impact assessment survey. She previously worked for the Centers for Disease Control as an Alan Rosenfield Global Health Fellow in Ethiopia and Cameroon. So each of our speakers will speak for 10 minutes or so, and then we'll open it up for Q&A from all of you. So thank you so much, and over to you, Mark.
Thank you, Monette. It's nice to see everyone here, and thanks for this invitation today. I'm really hoping in my 10 minutes to tell a story about a research process that was underway as COVID started galloping across the globe. One of the projects that we at the CPC are currently very embedded in is a program to measure efforts to prevent and to reduce the worst forms of child labor. And we were in the middle of the baseline survey in the Amhara region of Ethiopia when COVID arrived at scale in Ethiopia and the country went into lockdown. We had collected just about 2/3 of the data for the baseline and then shut everything down. And so I'm going to tell the story about how we thought about and picked up the pieces when the lockdown and the movement restrictions were lifted, what some of the considerations were, how we did our best to make this safe, and then just a few basic thoughts about whether or not you would want to try to finish in-person data collection for a survey in a situation like that. I will start with a quick note about the context, because at the end I will return to this. The context was very crucial in all of the decisions that we made here, and the area where we were undertaking this survey was rural, it was mountainous, and it was isolated. And we knew through our work with the Ethiopian Public Health Institute that COVID had not reached this region yet. So the burden was especially high on us to make sure that if we were actually going to have researchers who were not from this region go there, we did not want to ourselves, through the research, be the vectors of the disease. So do no harm was really a primary consideration there. I've already mentioned that this was a baseline for an experimental study. So when about a month after the lockdown was imposed, maybe 3 weeks, this particular region, the local government and the national government did lift the lockdown and the movement restrictions. There had been a ban on any travel in Ethiopia. And our partners in Ethiopia reached out and said, would you like to explore moving forward? My initial thought, being involved in the process, was, are you crazy? Of course, I was sitting in New York City listening to scores of ambulances go by every hour and couldn't imagine why we would want to do such a crazy thing. But they said, well, things are very calm in that region and we don't have any evidence of the virus having reached this particular spot. So think about it. So we did, and had lots of long internal discussions. Why would we want to finish this? And as we talked that through, this, as I mentioned, is a baseline survey. And one thing that's important to note is that the evidence base for child labor interventions is very thin. And so we thought, well, there's a possibility of making a significant contribution here. Is it worth the risks? And so then we started thinking through what the risks were. I think the the primary one, of course, is that we contribute to viral transmission through the process of undertaking the research. We did explore cell phone-based options, but did not have all of the participant cell phone numbers at the time. So it was either we finished the baseline using modified in-person data collection, or we simply accept the fact that we're going to have 2/3 of the database that we hope to have. So we saw the value, but really wanted to think about the risk. So how did we kind of check on the risks? Well, this is where the PopFam network comes in is a tremendous advantage. It turned out that an advisor to the Ethiopian's Ministry of Health was one of our alums, and an alum of the Emergency Medicine Fellowship, Dr. Sion Firu, who is based here in New York City, but also advises the Ministry of Health on emergency medicine. And so she provided us with some very basic advice, like get in touch with the Ethiopian Public Health Institute, but also had those connections and was a very kind and open person as we were trying to think this through. You know, they did have a testing and tracing program, and they really did have a fairly good sense of where the virus was spreading in Ethiopia at the time, and this region was not affected. So working with local health authorities and local administrative authorities, we were confident that, you know, we could actually go to these places. When I say go, our researchers were based in nearby towns, and so we did bring them to a village near the town, but not in the town itself, and have them tested and do their kind of refresher training along with all of the modifications nearby, but getting them out of that densely populated town that they were based in, near the remote and isolated region, but not totally part of it. Of course, we checked in with both the Colombia and the Ethiopian IRBs. Colombia's IRB wanted something from the Ethiopian IRB. The Ethiopian IRB said, we are nowhere near this region. You really need to be working with the local public health authorities and the local administrative authorities. So get us some information from them, and then we could think about proceeding. So that is what we did, and that we were able to do through phone calls and you know, very basic sets of questions that we asked in each of the villages we wanted to go to, and to the higher level, the Woreda level health and administrative authorities. What are the basic modifications that we made? We absolutely retrained everybody on what we would need to modify and why. And I think that most important point I would make is the why, because when we showed up in a particular village and then in a household, there was at that moment in time a lot of misinformation circulating about what COVID was and transmission pathways and those pieces. So just starting with, here is why we cannot shake hands with you, here is why we cannot come close to you. And it was a scripted introduction that really was about the modifications. Then lots of interesting little pieces that I never would have thought of myself. The government did have kind of capacity limits on vehicles. Truck was only allowed to take 4 people. We, of course, made sure that there was no contact between our researchers and the interviewees. But that also meant some really basic steps, like removing the point in the survey where the person touched the screen for consent, where we needed to then say, do you consent for me to touch this screen, indicating your consent? We even slight changes in things like we were giving a very small kind of honorarium for people's time for participating, just so that we wouldn't have to have bills and hand them over. We switched that to soap, which we kind of dropped off at the doorstep. And that was a recommendation. So all of these pieces, you know, limited cars, we could do far fewer interviews per day as we kind of had to lengthen the amount of time we spent explaining things to people. It increased the cost of the survey, but not dramatically so. And so we rejiggered our budgets to finalize it. If I were to leave you with 2 points points to think about. One would be to really think about the why. You know, is there worth and real value in completing your data collection now versus waiting a little bit if you need to do this in person? And that was something that we considered and juggled with, and did think we had a strong rationale, but then of course needed to make sure that we were able to take a do no harm approach and really minimize the risks and make sure that we were not contributing to any ill health in these sites. And secondly, context. This is a story as it played out in one rural, isolated area of Ethiopia. It would play out very differently anywhere else. And so following the leads of not just local authorities, but having a strong relationship with our Ethiopian research team. We were in daily contact with them. Not long after the baseline was completed, there were protests in Ethiopia, and the government shut down communications, the internet access, for a couple of weeks. And that, of course, was that's another blockage that you may face in some settings. But while we had access to phone and internet capacity, really it was a lot of asking questions and following the leads of the people who were living through this. So that is my story. I hope it was interesting, and over to the others.
Thanks so much, Mark. That was fascinating, and I love the very practical. I was taking notes furiously, tips on how to think about this going forward for the rest of us. So I'm sure there'll be lots in the Q&A. But right now, over to you, Neetu.
Thanks, Puneet. Hello, everyone. Thank you very much for joining us. A little different from Mark, I'm going to talk about an ongoing 6-country study that we designed as part of the, what is happening with COVID. And this is work we are doing as part of the Global Health Justice and Governance Program to understand the impact of containing COVID-19 on gender-based violence and sexual and reproductive health programs, and ultimately on women and girls. But before I talk about the specifics of our study and why we designed the study the way we did it, I think it'll be useful to discuss some of the challenges you have when you're trying to collect sensitive data, like such as gender-based violence, which gets even more challenging in a context that we are currently living in, and how ultimately your decision to sort of move forward with your data collection is really a cost-benefit analysis, and it gets even more important when you're thinking of sensitive data and your ability to collect good quality data that will actually be useful. So that will help you sort of understand how we sort of decided to design the study the way we did it. So what is the problem? So we are in the middle of this global crisis, which is exacerbating intimate partner violence and family violence on multiple fronts. And we really want to understand what the true impact is. But however, as you can imagine, the very act of collecting data in these current realities raises several ethical as well as data quality issues. And this is particularly the case when you're thinking about research on sensitive topics such as violence, which is ethically complex. You have to follow strict protocols, which that ensure, firstly, the safety and well-being of participants. Confidentiality and privacy become really, really important, both for safety of the participants as well as for data quality. And the need to have referral pathways to services. So if there is any re-traumatization that happens during the process of the interview, you should be able to connect your respondents to appropriate services. And clearly, these standards are really difficult to achieve in the current realities. We have social distancing and lockdown measures in several contexts, which limits the ability of researchers and respondents to travel. It is really difficult to, create a private and confidential atmosphere, especially if women and girls are living within their homes with their perpetrator, in the surroundings. And this is even more so the case when you think of remote data collection, because you really have no control over the space in that case. And access to essential services may be limited, or they may be administered suboptimally or not even available. And all these factors can, jeopardize the safety of your participants and have serious implications for data quality as well. Because if you cannot ensure privacy, you are going to skew the data, because women are really unlikely to share the experience of violence if the perpetrator is around, which would lead to an underestimation of the problem. So what do we do? This is the big dilemma. How do we resolve this tension between the need to gather data during these really unprecedented times and the reality that the very act of data collection can heighten risk and ultimately also lead to poor quality data, which is not useful and can really be very, very problematic. So the answer, of course, doesn't lie in not collecting any data, but rather really carefully thinking through and planning and executing your research. And some of the key principles that a lot of researchers working in this space have come out with is really following the globally agreed ethical and safety principles for data collection on violence against women and girls, and recognizing that this is even more important in the context of the current crisis, particularly if you're trying to collect data directly from women and girls. And the first question to always ask is, why do you need to collect these data? What are you going to gain by collecting this data? Now more than ever, you really want to make sure that the data that you're collecting actually benefits the communities that you are surveying. And if there's no real connection between results and action, the recommendation really is you shouldn't really be doing this research. And then ultimately, doing no harm is paramount. You do not want to proceed with data collection if there's any risk of harm. And the other thing to think is, what is the most appropriate data collection method and source for your context and your objectives? And always thinking about the safety of the respondents first. Are there secondary sources of data that you could use that could help you tap at your research question? Could you use sources of data that are not directly contacting women and girls, but can still give you some insights that can be useful for policy and program makers? For instance, could you do key informant interviews with service providers and frontline workers? Could you do rapid assessments and mapping of services to understand what is working and why, and to see whether women have safe options to report violence? Could you look at service and administrative data? Can that help you, get at some of the things that you're trying to understand? Beyond this, if you still think it's really critical for your study that you need to, directly get information from women and girls themselves, some of the safer options include sort of doing it within an ongoing intervention or operations research, or accessing women at service delivery points, because then you have control over the space and you can ensure some of the privacy issues. And in general, I think the guidance right now is that this is really not the time to be doing population-based prevalence surveys. But I do want to say this, that remote data collection of gender-based violence indicators has happened. People have done it safely, and it happens a lot in the high-income countries. It's not as popular in low and middle-income countries. So this is an option if you really think your research sort of wants to go in that direction, and it's will really be useful for whatever you're trying to do. But I guess there are many methodological challenges here, and I think Abha is more, she's the expert and she'll talk about that. But what you really think, when you think of GBV, you really have to think about the privacy breaches, in this methodology, since you don't really have control over the space, and the recognition that in many low and middle income countries, women don't really own or control communication devices. So it really becomes problematic in that context. So, given this reality, this complexity, for our research, we sort of decided to take the path of least risk. While we are interested, in understanding what is happening, understanding and talking to women and girls directly, our real goal in terms of our research was to understand how policies imposed during the COVID-19 in terms of lockdowns, movement restrictions, government policies on GBV and SRH services are affecting the availability and quality of services, and also try and assess if particular groups of women are more vulnerable and not able to access services. And we were also interested in doing rapid research that could then funnel back into advocacy with donors and policymakers. So all of these reasons made us feel that this wasn't the best time for us to sort of try and do this really complex research and trying to sort of access women and girls. So instead, we decided to tap into key stakeholders in the different countries. And so we're doing a desk research as part of our study to understand government policies, as well as tap into some of the ongoing research. We're doing a web-based survey, which is 20-25 minutes in length, and it's really targeting GBV and sexual and reproductive health program and service providers to understand some of the challenges they're having in providing services, and who is able to access those services, and how the policies of the government, both in terms of funding as well as other policies affecting their work, as well as affecting the larger context of the country. Then we're also doing remote stakeholder interviews. These are about an hour long. And these are, in addition to program and service providers, we're also talking to policymakers and donors and getting a really more in-depth understanding of what's happening in the country context. And then finally, we're also sort of trying to tap into available service and administrative data to look at trends and see if there's any useful data that could be used to sort of build a case. Overall, I think our approach has worked for the kinds of information that we are trying to get. We're still in the early stages and sort of collecting data at this stage. And I guess the major challenge for us has really been, the fact that it is really a stressful time for everyone. And it's, we've had to be really patient in sort of setting up those appointments and getting those, making people sort of come to our remote sessions and answering all our questions. And so that's been the challenge, but overall, it has worked well so far, and hopefully we will get really useful data that we can use for our work. Thank you.
Thanks so much, Neetu. I see some real themes emerging between your presentation and Mark's presentation, some principles to live by: do no harm, the cost-benefit analysis, really thinking about what it is you want to get out of this research and the value added of taking that risk if need be. So I'm going to move on now to our final speaker, Abba, to tell us a little bit about some work that I know you're doing currently as well.
Thank you, and thank you for hosting me, and I'm really enjoying learning from Neetu and Mark as well. So this is both an opportunity for me to learn and to share. So as Monette mentioned, I have been working in cell phone data collection actually for about the past 4 years. My first experience was in Niger. I was working with an old CDC colleague who was setting up a community human and animal health surveillance system. So we were trying to look at and improve polio surveillance by enlisting especially animal workers who would have more contact with nomadic populations. And this was my first taste of, oh wow, people, phone ownership is increasing. It can be a tool for public health. And I really enjoyed the experience. We were doing robocalls. So we were sending, we were pushing a call to these health workers once a week for them to tell us if they had seen any acute flaccid paralysis, which is a proxy for polio surveillance, as well as measles. And then on the animal health side, rabies, and then PPR, which is like, I think kind of like smallpox for animals. I don't know, it wasn't, I never got a clear look at that. So it was a very interesting introduction. And from there, I ended up working in a couple of different countries in sub-Saharan Africa, looking at different ways to increase response rates for cell phone surveys, and then did some work in Burkina. So I've really enjoyed looking at whether or not cell phone surveys are a good idea. And I'm often the wet blanket in the room, telling people to slow down and be careful. But it has been really interesting in the past 4 or 5 months to see the research that has come out has been almost as much as has been created in the past 4 years. So this has been a huge time for cell phone surveys, which makes sense. And I'm really looking forward to seeing more publications come out. And just to note right now, the World Bank has a lot of great resources. I just saw late last week that they're doing a panel survey in 5 or 6 different countries in sub-Saharan Africa. They're calling them monthly. IPA has great resources, as does the Software Survey CTO. So I want to talk a little bit about research I'm doing in Lesotho. In April, I started thinking about what resources does ICAP have? How could I use some of my experience with cell phone surveys to help the COVID-19 response? And ultimately, my colleagues and I were funded to create a surveillance system in Lesotho to look at flu-like symptoms, which is a proxy for COVID. So I kind of, as I was thinking through what would make sense, asked myself 5 questions. I'd like to share those 5 questions with you as I explain the surveillance system in Lesotho. So the first thing I had to think about was, what kind of data was I trying to collect? Did I first want to do a survey? Was I trying to make population or group-based estimates? or was I trying to do monitoring and evaluation? Was I following up with a group of people who were enrolled and trying to look at an intervention? I actually saw research last week come out from Kenya. They looked at a cohort of adolescents living with HIV and called them to find out about COVID knowledge. So they did a nice job of tacking on a knowledge, attitude, and behavior survey to this group. Or the other type of data one might want to collect is surveillance. You can do it of populations. We saw this a little bit in Ebola 2014, 2015, calling populations to try to create estimates, but you can also do what we did in Niger and call healthcare workers. So in Lesotho, what we decided was we were going to collect surveillance data, but from a population that was nationally representative. And I'll talk a little bit about how we found that population in a moment. So I think first think about the type of data you're trying to collect, and then you need to think about who you're trying to collect it from. So broadly speaking, phone owners in sub-Saharan Africa are male, they're educated, they're urban, and they're young. So to say that in the opposite way, if you're trying to collect data on women, the uneducated, the rural, or the elderly, it's going to be really challenging. And any sort of combination of that will be tough. In a random digit dial I did in Burkina, for every 30 people that picked up, one was a woman 14 to 19 in a rural area. It was really a lot of work to find hard to reach populations. So if you're thinking about doing a cell phone survey, think about what does cell phone ownership in that country look like? And as Neetu mentioned, women may not always be the phone owner. So in Burkina, again, for example, 80% of households owned a phone, whereas only 47% of women actually owned a phone. And we started phone surveys in the US in the 80s when about 80% of homes had landlines. So that's a nice percent to look towards. If you're less than that, you need to think about who you're missing and how that may impact your outcome of interest. In Lesotho, we found that 40% of the population owned a phone, and that the differences between owners and non-owners was not too egregious. So the third question you have to ask yourself once you know the kind of data you want to collect, who you're trying to get the data from, is how are you going to find them? So the first way you can try to get a hold of people, and this is what we see in the US, is random digit dial. You can create a list of phone numbers. It's challenging. I won't go into the details. It's not my first choice. The second way is administrative records. For example, we were thinking about doing a phone survey among the elderly in South Africa. And we were looking into getting phone numbers from basically the South African equivalent of the Social Security Administration. So there may be organizations or government entities that could give you a phone number. What we did in Lesotho was a follow-up to a face-to-face survey. So we, from December to March, had just done a nationally representative HIV survey, and we'd asked people for their cell phone numbers, and we called them back. So we called about 3,000 people, and 60% of them enrolled for about 1,800 people enrolling. I think we're going to see more and more face-to-face surveys, if not all, asking for phone numbers due to COVID. The nice thing about a face-to-face enrollment is that you have a wealth of data about the participant. You know, phone surveys can't be quite as long as a face-to-face survey. So when you're enrolling from the face-to-face, we have, you know, a 300 question survey that we can dig into to find out more about our phone respondents. The fourth question that I asked myself was, how often do we want to contact them? If you want to do a one-off, it's a lot simpler, I'm finding. In the past, I've only done one-off, just calling respondents once and collecting data. If you want to call them multiple times, whether it's monthly or actually in our case weekly, you really need to think about how you're going to keep them engaged. Two things that we thought about in Lesotho. One, incentives. If you answer, again, we're calling them weekly. If the respondent answers all 4 weeks, they get $2. If they answer 3 of the 4 weeks, they get $1.50, etc. The other thing we've tried to do is have a two-way street. We are giving them information about COVID-19. We trained our interviewers extensively to help dispel any myths, and we post and share with our interviewers every week the number of COVID-19 cases in Lesotho, so they can report that out. We thought that that was the ethical thing to do. We're not doing a knowledge, attitudes, or behavior survey, and we thought that it was important for us to share the knowledge that we have during this crisis. I can talk later if you want. Weekly phone data collection is hard. We lose about 4 to 5 people a week, some because they're moving, but it's really hard and it's also just logistically challenging. I wouldn't choose to do it again if I can be honest. We're doing okay, but it's really hard. The last question I asked myself as I was setting up with colleagues this phone-based surveillance system in Lesotho was, how can I reduce measurement error and bias? So of course, phone survey questions need to be even simpler than face-to-face or web questions because the respondent needs to keep the question in mind as you're going through. Something that's been interesting in this study, because it's weekly phone follow-up, and I heard another colleague who works in phone interviews say, you get a lifetime of face-to-face refusals and like a week of phone interviews. Like the respondents get rejected a lot. They're used to being face-to-face interviewers. So we've had to work on staff morale. There was a recent request for a staff barbecue, but we've done everything remotely, so we couldn't agree to that. Looking at the number of hours worked, we've had to try to adjust that throughout. So keeping staff morale high is definitely imperative when you're doing follow-up for a year. And remotely, you have to be a little bit creative as to how to keep people involved. Something else that's been interesting is Survey CTO is a software we use, and they have quite a few capabilities that I would suggest people looking into. You can record calls, or supervisors listen in, and that's quite helpful. Finally, I'll say when you're thinking about reducing measurement error and bias is have a great training. We did ours remotely, and we're lucky that in Lesotho internet quality is high, so we didn't have any issues, but we were able to do a pretty robust training, which helped quite a bit. That's all from me, so I'll pass it back to you, Lynette.
Great, thank you so much, Abba. So much information in your presentation and in our colleagues. Now, I have a couple of questions, but I would like to open it up for our audience to raise their little blue hands. We have about 20 minutes left for Q&A. And so what I'd like to do is to take 2 or 3 questions at a time and then pose it to our panelists. So, don't be shy. Lizzie, do you want to remind people where they can find the little blue hand?
Yes, sure. So you should be able to find it if you, now it should be participants, and then you should be able to see a little blue hand that says raise hand on the participants icon button. You hover your mouse over the screen.
Wonderful. I already see a question from John. So John, if you could put your video on and pose your question to our panelists, and then we'll see if some others come forward. If not, I'll throw mine into the mix.
Excellent set of presentations. Lots of really important practical advice from everybody. So that was great. I guess I wanted to, raise a question about research ethics and the IRB system. And clearly Colombia has had a institutional shutdown of research, mandated by the university, but every university has orchestrated their shutdown and then their ramp up in different ways. And so we did it through the administrative system, but many institutions have done it through the IRB system. I've had the experience in the last couple of weeks of both ramp up with my Uganda project, which was shut down for 3 months, but also to service on the Pop Council IRB, where we had just a really contentious discussion about a particular protocol in Kenya. So, long-winded question, but I guess if any of the speakers today want to comment on how to coordinate either with Colombia or with local IRBs and the other institutional safe guardians, should we say.
Wonderful. Thank you, John. Yes, I think IRBs are very much on everyone's mind, and we are being recorded, just a reminder. So it'd be great to get your feedback. Are there any other questions for the time being? Perhaps I might add one into the mix for our panelists to consider in addition to the IRB question. I think Abba began to tease out in a very useful way what the implications might be for the way we work with local partners. You know, this question of having a robust training, really thinking about staff morale and what it's like to be on the ground working in these circumstances. But my question, I suppose, wants to push us a little bit further. I mean, I think if nothing else, perhaps the silver lining in all of this is that we have to be absolutely clear that our local partners are fully invested partners in the research as we vision it and conceptualize it. So how do we really bring them on board to understand projects that they may not have had a chance in conceptualizing and developing, but they really need to kind of internalize because they are our eyes and ears on the ground. And so we need them not just to be enumerating and recording data for us, but to be doing the kind of observation that we would normally be doing if we were ourselves in the field. So how do we build that kind of environment of partnership that brings people in and that invests them in the research we're trying to do? So I will leave it at that. So there are two questions for you to consider. Who wants to go first? Oh, I'll just call on you then. Mark.
I'm happy to. I was about to unmute. John, on your question about the IRB, I think you used the right word, which is coordinate, and to remember that, you know, the study itself is the one responsible, and that Colombia's IRB and national IRBs and local authorities, I think in our instance, were very important, you know, are all part of the ecosphere. Of course, we can't proceed without Colombia's IRB, you know, approval, but they, you know, typically in our instances anyway, have always, I don't want to use the word deferred, but they certainly want to see that local IRBs have taken a good hard look at things. And I thought that our Ethiopian IRB's response was really spot on, which is we are sitting in Addis Ababa. We have absolutely no idea. We can write you a letter if you can get a letter from the local health authorities and the local public authorities, the administrative authorities. So they were kind of putting that coordination role back on us, which I thought was really appropriate and made us keep doing our homework in an ongoing way. I think of the various entities, Colombia's IRB is probably the least engaged and responsive, and I'm happy to say that on the record, and take some more gatekeeping role than the others who really are trying to help you figure out the best way, in our experience, you know, the best way forward. So, you know, that is the nature of some IRBs, and they are institutions like all others and develop their own kinds of protocols and ways of working. On the partnerships, I think you said something interesting, Muna, which was how do we bring them on board if they haven't helped with the conceptualization and the design? And that, I don't know the answer to that piece, because I actually think it is at the conceptualization and the design that all partners need to be at the table. And so if they are, then they are fully engaged members of trying to make this work with the whole team when modifications are necessary. And so I would actually make sure that it is at that moment of even starting, you know, what kind of research do we want to do here and what do we want to learn? The basic setting of research questions really should involve national partners from the very, very beginning. So, over.
Others would like to chime in?
I'm happy to say a few words. I don't think I can really answer John's question, partly because the research we did, or more research case study that we did, is a little different in the sense that, you know, we were talking to stakeholders and not directly to participants. So Colombia gave us an exemption in terms of the IRB. And, you know, we thought about the local you know, whether we should go via the local IRBs. And so we consulted with a lot of the consultants and local experts on the ground to assess if we should go and also get clearance from local IRBs. And what we realized is it would take us 3 to 6 months to get any such clearance, and that would sort of defeat the purpose of our research, which was supposed to be rapid and sort of funneling back into, to the donors and the policymakers. So in consultation with our teams on the ground, we decided not to go and get local IRB and sort of manage to still collect data. I don't, but I guess the only challenge there is we will not be able to access any direct service statistics or administrative data, any raw data. We will only be able to use, things that are already coming out officially. So that's the biggest disadvantage for us. But other than that, we were able to really talk to all the civil society groups that we wanted to talk to, even to some extent, government officials in their private capacity. And we were really interested in sort of getting a critical look at what is happening on the ground and not so much about the government's position. So for us, I think that has worked really well, and we were able to sort of continue our research. In terms of the localization aspect, again, like Mark, I feel the same way. Like, you really have to have people on the table and sort of go in as partners when you do the research. And that's how you really have the ownership. And, and the way the trend is going, you often tend to have them as the prime and you're a sub. And so then they really sort of own the research that they're doing. And again, in our case, it was a little different. Our study was a little different because, again, it's a rapid assessment. We hired consultants on the ground, but these are, really high capacity consultants. They are experts in their field. They all, have been faculty or have worked in major, big, leading organizations in their countries. So we didn't really have any problem in terms of capacity, and they were so invested in the project because of their own personal interest and their expertise. So it has worked really well for us in that sense too, even though, we sort of got them on board after we conceptualized the research in this case.
Mm-hmm. Great, thank you, Neetu. Albert, anything to add on that?
I think they've covered institutional ethics boards coordination well. Just to say about working with local partners, bringing them on board remotely, and how we hopefully have worked towards making our local partners even more equal partners. I really miss the in-person interaction. It's been hard to start a project in a country or with people I've never met face to face. I really enjoy working with people to bring them up to speed. I've done this a couple of times, working with specific people who've done face-to-face surveys and introducing cell phone surveys. And I spent some time on Zoom with the call center coordinator and then his supervisor before the training, so that they had some information and they could do many of the training sessions. I still joined in the afternoons when I could, just to listen in and add some context. One of my favorite weekly Zoom calls is actually with the implementation team. So I get to hear from the 2 supervisors. There's 2 supervisors for the 16 interviewers and the call center coordinator. We just talk about like what they heard on the recordings. We talk about, the different issues that have popped up, and I really enjoy that. And that is, I guess, how we're capacity building. We got off the ground pretty quickly, so there wasn't a lot of time to dive in and train beforehand. So we're kind of learning and doing it together. But I don't have the perfect answer for that question. But I think that the wealth of the experience that our staff had from face-to-face surveys, it really just required a slight re-navigation towards cell phone surveys.
Mm-hmm, mm-hmm, mm-hmm. Well, very helpful. Thank you all. Thinking about some of the set of circumstances, for example, that I'm facing, I think the takeaway is that we, as we go back and rethink how to do the research, it really does open up the space for making sure the local partner is there right from the beginning. So reconceptualizing, not just trying to attempt to find a methodological way through. So I don't see any more blue hands. I do have one more question myself, but Mikal, am I pronouncing your name correctly?
Yes, hi.
Please go ahead.
Sure. My question is actually about violence against children. You guys have been talking about hard to reach populations and methodologies like using cell phone based approaches. And obviously they're even more hard to reach because of course they're not going to be having the cell phones. And in this situation of social distancing, with schools being closed, here with online learning, and I guess elsewhere. Can you speak to that, just how to actually access that group accurately?
Wonderful. What a great question. This is the last opportunity for anybody else who has a burning question to pose. Stephanie. Okay, excellent. You made it in. Let's take yours as the last question. Stephanie Haddad.
Yeah, I was just wondering if you guys have seen any ways that the field of research has improved with having to pivot due to COVID, and if you see any changes long term from the adaptations that you've had to make during COVID. I think you guys kind of touched upon it with, I guess, since everyone's learning how to use Zoom, you can be at more meetings, but like other silver linings that you think you will continue even after this pandemic has at least lessened so that and research goes back more to normal.
Interesting. There is some new guidance coming out soon. I reviewed a final draft of it maybe 2 weeks ago from UNICEF's Office of Research in Achenti. They're really recommending against asking children about violence at this moment in time, given all of the uncertainties that we have. That it's not a hard and fast rule. And I, as I commented, I recommended to them that they do consider data collection within the purview of service provision, and service providers who are trying to improve their services, they will certainly want to be asking children about various forms of harm that they're experiencing right now so that they can adapt their services to them. But from a research for learning perspective, as they are couching this, they are taking a pretty hard stance that this is not the moment in time to be asking those questions. So I can see it. I've been mulling it over since I saw that. Saw the report. It should be out fairly soon. But I also am very cognizant that just because people started staying at home in large swaths of the world and schools were shut down in large parts of the world does not mean that children do not have tremendous difficulties in their lives right now. So we need to make sure that those who are mandated and or expected or are in touch with children are able to ask these questions safely. I think the biggest concern is that is again, do no harm, and that the asking of the question is not likely to fall back upon the child in some form of reprisal. So that's the kind of key ethical consideration that I keep trying to bear in mind. And I'll jump right to Stephanie's question as well. And I actually think this is a tremendous moment for, although I don't love the word, localization. And this is a point in time where our inability to be physically present in a lot of places, our being, in my instance, somebody from the United States, is kind of forcing upon us a more egalitarian partnership and reliance upon people in other countries. I think we were fairly decent at it already. But now we also aren't given the choice of popping up in country to double check or do quality control. And so you really learn to build the trust in those relationships and to ask each other hard questions. So I actually see that as one of the strong pieces that this moment could help us with moving forward. Thanks.
Great. Thank you, Mark. Neetu, anything you'd like to add?
I could talk about the silver linings. I think in terms of violence against children, I will leave it to Mark to have the final word. And again, like Mark, I think localization, and I think Monette, you've also already said this is, I guess, the number one moment for us who work in global health, that there's sort of even, more greater recognition of that, how critical that partnership on the ground is. Then I think also, I guess, a time to really think about our research and, what are we trying to do and why, what are the reasons why we're trying to do what we're doing, and what are better approaches to do it? Can we do it in more innovative ways? So I think it's also a good time for that, to really reflect and think about your research and who benefits from it, and are there ways that you could do it that can even have bigger impact and, lower the risk of any harmful effects.
Wonderful. Thank you, Neetu. So Abba, you're going to have the last word here.
Besides our reduced carbon footprint, for me, silver lining is the one that pops out naturally is just, I think people will use more modes. They'll start to use web more, as Neetu explained what she has done. Cell phone surveys will be better understood and hopefully used in the right context. So there are times when it is really important to collect data more frequently, and people now understanding that you can go from face-to-face to mobile, back to face-to-face, understanding the different modes and how we can use them interchangeably, I think will help us get data that is useful and at a cost-effective way. That's one of the main reasons people wanted to get into cell phone research, was because of the cost. So we're getting just a wealth of data there, and hopefully people will reflect about how and when to use cell phone surveys, because they'll have a much broader literature base. So for me, I'm interested to see how things go post-COVID with cell phone data collection.
Fascinating. I think I have very little to add to what the panel has said. I do think this is a really interesting moment for the localization agenda. And, you know, I think if nothing else, we will come through, I hope, with much stronger local partnerships and investments in local capacity going forward. I also think, perhaps as you know, Abba was suggesting, it's making us much more careful about what it is we're researching. Is this research really necessary? Is it critical? Are there ways to do it so that we are as effective in our time usage, so that the refugees and displaced populations that we go back to again and again feel that this is something useful for them in the long term, that we aren't just you know, overtaxing them, as we sometimes hear when we go to the field, where they feel really oversampled and over-researched. So I do think there's that dimension that's coming through as we think very carefully about why this research, why this question, and are we doing it in the most efficient way necessary or possible. So with that, what can I say? What a great panel. I mean, we kept to the hour. You were so practical, all three of you, and yet you're doing incredible things through the research that you have managed to continue and to start up in this current context. So thank you, you know, for sharing with us your thoughts and your ideas, giving us your guidance. And I look forward to continuing to work with all of you and to the rest of the seminar series for the semester. Thank you all for joining us, to our audience, and we'll see you same time, same place next week. Thank you all. Can I clap?
Thank you.
Thanks, everyone.
Okay. All right. See you next week, everyone.